Dr. Park Jung-chul. I'm with the Hyo Dental Clinic. Today we are going to talk about how to retrieve failed implants and provide retreatment. Let's have a look at an initial visit image. A 67-year-old female at number 36 and 37 implant sites, bone loss increased and inflammation developed. So she came to our clinic for treatment. The plan was to remove the implants and place 2 new implants. Inferior alveolar nerve was closed, therefore it would not be right to place another implant after removing the existing implant. So the plan was to remove the implant and build alveolar nerve using GBR, and delayed implant placement will be performed. If necessary, more GBR will be performed at the time of the placement. If you look at the oral photo, the soft tissue contour is not very good. I'm not sure whether it was like that from the beginning or due to the peri-implantitis. Anyway, soft tissue contour is not very good. Therefore, soft tissue improvement should be included in the plan. First, the implants were all explanted. The vertical bone defect was severe, so GBR was done to recover it. Non-resorbable membrane needs to be used for the treatment to recover vertical deficiency. And I believe that is the right approach, but in this case, the soft tissue contour was not really good. So when a non-resorbable membrane is used and if it is exposed, the result can be worse than not using the membrane at all. Thus, the use of non-resorbable membrane was not considered. Resorbable membrane was selected. Therefore, resorbable membrane would be fixated to increase wound stability. The membrane would be fixated and GBR will be conducted. So resorbable membrane and AOS collagen were used for the grafting. As you can see, you see the bone tags, and allograft and AOS collagen was used for the grafting. After that, this is about 5 months after grafting. Anyway, healing was properly progressing. As you can see, the scar tissues are abundant in the soft tissue, and the keratinized tissue width is very narrow. It was necessary to make efforts to improve soft tissues. When placing implants, we need to pay attention to the distance to the inferior alveolar nerve. The distance was very short, so the plan was to use a surgical guide for the placement. Number 36 implant has some safe distance from the inferior alveolar nerve, but number 37, it is very close to the inferior alveolar nerve. Safety zone is about 1.5 millimeters. When drilling for surgery, we can use 1-485 kit for safe drilling. So the plan was to place implants using 1-485 kit. 1-485 kit has drills like casket for sinus lift. The drill end is not pointed, it's flat, so safe drilling can be performed. Drill will not tear or touch the inferior alveolar nerve, so 1-485 kit is included in the plan. So the plan was to use a surgical guide and a 1-485 kit to place implants without raising a flap. Diagnosis using the guide indicated there is no need to do more grafting, so flapless implant placement was planned. and after the placement, FGG will be performed later. Now let's check out implant placement video first.
하겠습니다. 바꿔주세요.
내가 바꿀게.
This is the post-op panorama radiograph. If you look at here, number 37 implant was very close to the inferior alveolar nerve. It is touching the nerve. The patient complained of slight pain, so I took the image and it was too close, and the implant was rotated upward 360 degrees, so it was moved upward 1.5 to 1.8 millimeters upward. And another panorama was taken, and now there's some distance to the inferior alveolar nerve, and the patient felt the reduction of pain, and we are concerned about numbness in this case. Fortunately, on the next day, we contacted the patient, and the patient said that there's no numbness or nerve paralysis at all. So I realized the value of using 1/485 kit drilling. It provided a very safe surgery close to the inferior alveolar nerve. About 2 months after implant placement, FGG was performed to secure keratinized tissue on the buccal side. As the bite was low, final prostheses were not delivered. Now, temporary teeth are used. On the buccal side, some keratinized tissues were made, not much, and the patient can eat without discomfort. This concludes the case description, and I'll come back with another case. Thank you.